Please write any questions you have regarding the content into the chat box. We will be stopping several times to answer them. We may not be able to answer all of the questions posed today due to time constraints. Please keep the questions broad. We cannot give out any legal advice today, and questions regarding very specific situations will not be answered. We'll be adding links to relevant information into the chat throughout the session, and there will be a 5-minute break halfway through to allow you to stretch your legs. So we'll just introduce Welfare Rights Centre. Welfare Rights Centre is a community legal centre specialising in social security and family assistance law. We provide thousands of New South Wales residents each year who have a problem with Centrelink with information, referrals, and legal representation. We welcome clients from throughout New South Wales, including the following priority list. The priority list. So our peak organisations are Community Legal Centres New South Wales and Economic Justice Australia, who we work with to advocate for law reform. I will now hand it over to Donna.
Hi everyone, thanks for coming along. So what we're hoping to do today is we're going to go through sort of the basic structure of how Centrelink make decisions on the disability support pension.
Sorry, Donna, you just have to unmute.
Where you might be able to find evidence and what you need to look for in your evidence to avoid some common pitfalls, and what resources might be out there that it's available to you and your clients. We'll go through a couple of other things as well as how to appeal decisions about the DSP. So as Brie has already mentioned, we're not offering legal advice today. It's really important that you understand that even though I'm a lawyer, this is general information only. It's not legal advice. And if you or your clients want to get legal advice at all about their circumstances, please contact us or one of the other members of Economic Justice Australia. So we will start with general issues that people have with trying to access a Centrelink payment. So these are not specific to the disability support pension. But when you or your clients are trying to get a payment from Centrelink, that you need to be a permanent resident visa holder or an Australian citizen, except for some particular circumstances. You need to be located in Australia when you lodge your application. You need to intend to remain in Australia for a minimum of 2 years after you've lodged your application. You need to consider Australia your home, and Centrelink are going to be looking at your income and your assets for both yourself and your partner, and you need to prove your identity. So you need proof of ID. With the disability support pension, there's obviously added criteria. So this is a bit of a flowchart that we've created that might help you in the future to remember the different steps and the different stages along the way of proving that you're eligible for the disability support pension. And we're going to slowly go through it, but I thought I'd give you the full picture first. So the first question you need to be asking is, does my client have a manifest eligibility for the disability support pension? So this is where it doesn't matter, about all the other steps that we're going to be talking about later. If you tick one of these boxes, you'll get the disability support pension immediately. So you need to have a terminal illness with a life expectancy of less than 2 years, but you need to also be unable to work. You need to have a permanent blindness, an intellectual disability of less than 70 IQ points. You need to require nursing home level care or be category 4 HIV/AIDS. So some of the top tips for proving manifest eligibility is that vision is both visual acuity as well as field of vision. So if you have a field of vision of less than 10%, you might be eligible even if you have a good visual acuity. There are recommended tests for intellectual disability, and the list of those tests in the impairment table 9, and we'll be talking about impairment tables in more detail later. And also it can be really hard to get a doctor to commit to a particular life expectancy, but maybe check with your client whether they've applied for early access to superannuation or early access to life insurance, because sometimes specialists will fill out forms due to life expectancy to assist their patients to get that early access, and those forms can be helpful. There's a particular form to prove manifest grant of blindness. It's a really quick and easy form to complete, and so look out for that one as well. So going back to our flowchart. So the first thing you need to look at is, do they satisfy that non-medical criteria? So residency, income, assets. And if they don't, then they're not going to be granted the DSP. If they do they meet that manifest criteria? And if they do, you miss everything else, your DSP is granted. If they don't, we move on to the next steps. So to get the disability support pension, you need to have a physical, an intellectual, or a psychiatric condition that results in an impairment of their day-to-day life and their day-to-day activities of at least 20 points. And these are measured on documents called the impairment tables. We'll be going through each of these things in detail. You also need to have a continuing inability to work. And you need to be of working age, which means you need to be 16 years or older or under the age pension age when you are claiming. So to have an eligible physical, intellectual, or psychiatric disability, you need to have been diagnosed by the appropriately qualified medical professional. So it's not just a diagnosis by anyone, it needs to be a diagnosis by someone who's appropriately qualified. You need to be reasonably treated. And so that means essentially that you need to have done the treatments that are normally suggested and recommended for the disability that you are claiming, as long as those treatments are reasonable. So they're looking at things like, are they accessible? Are they affordable? Are they available? You know, are you going to be able to actually undertake that treatment within the next 2 years? You know, you might have a waiting list of 2 years for surgery. Yeah, and that means it's not reasonable. Is the outcome, you know, reliable? Is there a high chance of success? Is it experimental? If it's experimental, you're not going to be required to do it. Is it contraindicated because of other conditions that you have? Is there a high risk to it? Are there any other reasons why it is not appropriate for you to do it, or why it shouldn't be considered reasonable? So before the 1st of April last year, the requirement was that you needed to be fully treated. And now it's reasonably treated. So that there's a lot more leeway in what is considered reasonable. You also need to be considered stabilised. So it needs to be managed and under control and not in a state of crisis. They recognise that some conditions fluctuate and deteriorate, but it needs to be seen that there is no treatments remaining that have that chance of improving your condition to a point where sometime in the next 2 years, you might end up with the ability to work for 15 hours a week or more. Okay. So stabilised and treated are very, very significantly linked. Okay. And you need to have a condition that's going to last for 2 or more years. So if your condition isn't going to last for that long, then you won't be eligible for the disability support pension. So throughout this session, we're going to have some different case studies, audio and visual case studies. So this is our first one.
Thank you for calling, Mariam, and nice to meet you, Andrew. Andrew, as you know, I've been helping Mariam with her application for the DSP, and as part of that, I've had a look at a report that you've written in March.
Yep. Yeah, I can't understand why Mariam is not a DSP already. I've told Centrelink everything I can twice, including that she can no longer work. She should be on DSP by now.
Yep. Yeah, I understand. Centrelink requires evidence on very specific questions under the disability rules. And having a look at your report, I think we can amend it just a little bit to address some of those issues.
Well, I can actually understand why he doesn't want to keep writing letters, because we've tried twice already.
But if there's a quick process, I'd be happy to try one last time.
Great, thanks, Andrew. So I see that Mariam was diagnosed with by yourself and a psychiatrist, has been receiving treatment regularly for 3 years.
Yeah, she's been coming to see me on and off for about 2.5 years, and we check. Yeah, and fortnightly for the last 6 months.
Yep. Okay.
She was first, I think, Dr. Campbell two years ago, and she's been reviewed by Dr. Campbell each year since. As I said in my letter, I've heard her for her second annual review in March, with the idea that her medication would be adjusted.
Well, Dr. Campbell didn't actually make any changes to my medication. And she said there was no reason and that she'd see me again in a year.
Okay. Well, look, Mariam, we'll discuss those issues. It's really I think an issue with the information that Centrelink is requiring. So there are a number of things that Centrelink looks for when making a decision about eligibility for the disability support pension. I'll just talk to you about mental health conditions. So for a mental health condition, it needs to be diagnosed by a clinical psychologist or a psychiatrist. Now, I can see that, Andrew, you've you're a qualified clinical psychologist, and you've clearly stated Mariam's diagnosis in paragraph 2 of your report, so we can tick that issue off the list. The next thing that Centrelink looks at is whether Mariam's received all treatments that could possibly improve her condition, where she could be in a position to work for 15 hours a week or more. And I think that's where the claim has gotten stuck.
Well, Mariam won't be able to return to work, and I think that's clear from the medical evidence about regarding the severity of her condition.
Yeah, it's well described. I believe the issue may relate to a sentence in paragraph 3 of your report, where you refer Mariam for further medication review, and you've also made a referral and mentioned that she might benefit from rapid eye movement therapy. Now, from that, I think Centrelink has assumed that there are treatment options available which could improve her condition, where she could return to work.
Although, I'm just looking at my report here, that's not the case. The medical review was a routine annual review to ensure no adjustments were made to maintain her current health status. We don't expect that any change in medication will improve her condition. The rapid eye movement therapy may provide some improvement, but it's unrealistic to assume there'd be enough improvement for her to return to work.
Okay, great. Well, in that case, I think just adding a single sentence to your current report would be enough to provide clarification on that issue, particularly if you can make it clear that even if Mariam could return to part-time work, that it would only be possible, work would only be possible for a few hours a week.
Well, I can't go back to work. No one would give me a job anyway with my history and all my issues, and I can't be around people.
Yep. Yeah, I understand, Mariam. And this is what we're trying to get at, I guess, in this report, and convey this to Centrelink in the way that they want it.
So having a look at that, you can see that the client had lodged a claim for the disability support pension and Centrelink had rejected it, that she had a supportive specialist, and that Centrelink had found that her condition was diagnosed but hadn't been treated and stabilised. And the issues within the report were that the specialist had said that she needs to go for a medication review and that she might benefit from the rapid eye movement therapy. And the solution that was provided by the solicitor, that a single sentence, that single line from the specialist saying that that medication review was for maintenance only, that any benefit from future treatment would be limited, and that at no point in the future, or, you know, and even if it's just in the next 2 years, that the applicant was going to have improved enough to be able to work 15 hours a week or more. So a single sentence was enough in order to change that rejection by Centrelink into the granting of the disability support pension. Look, one thing about that particular video is it was filmed before the changes in April 2023. And you'll note at the beginning of the video, it said that the diagnosis needed to be done by a psychologist or clinical psychologist, or a psychiatrist or clinical psychologist. Because of those changes, Centrelink has relaxed that requirement for mental health diagnosis, and you can now have a diagnosis by a registered psychologist or a clinical psychologist. So they're less strict with mental health now. So thinking back to that, some of the common pitfalls with diagnosis is that you actually don't need a specialist for some conditions. It's diagnosis by the appropriate medical professional. And sometimes a GP is plenty. You don't need a specialist for some conditions. But when you're looking at the reports and the medical records, watch out for reports that go, you know, it'd be useful to explore, you know, or investigate a diagnosis or a condition, because that can prompt Centrelink to decide that actually they haven't been diagnosed completely yet, that there may be changes to the diagnosis in the future, and so therefore they won't tick that box that the person has been diagnosed. So, and that appropriate specialist can be incredibly difficult when you're in areas without that specialist being available. So this is a client that we had. They lived in a rural town. There were no psychologists or psychiatrists in their town. They'd been seeing a counsellor and a GP for many years, but they'd never been able to see a psychiatrist or psychologist. So she applied for the DSP with evidence from the GP. Centrelink rejected the application because she hadn't been diagnosed by that specialist. And Sharon and her GP spent 2 years trying to get an appointment with a bulk billing psychiatrist or psychologist, and she was willing to travel. So she was happy to go interstate in order to get a bulk billing specialist, and she wasn't able to get one, and she was rejected because she just did not have that diagnosis. And you know, our last contact was quite a while ago now. She still hadn't been accepted. She still hadn't received the DSP. There has been a change of policy recently. I've not seen it in action. I've not seen it used. However, there is a change of policy where if you're in a remote area with no access to health services, then you might be able to get a diagnosis by an internal Centrelink practitioner, a health practitioner. And there's a link there to the policy document that contains that. So, common pitfalls with reasonably treated. So, like in that video, the words may benefit from. Centrelink can't assume that the benefit will be minor. They must assume that the benefit could be enough to get the person back to work within the next 2 years. So if that benefit isn't going to get them to work in the next 2 years, then you need to make it clear in the evidence and in the documents, okay? Some conditions are always going to require a particular type of treatment. So mental health, they always want to see therapy. Chronic pain, they always want to see a pain clinic. Knee issues, or, they're going to want to see an orthopedic surgeon. Okay, so just be aware that some particular conditions, you're always going to have to see some particular treatments. And look, just go with, if they've changed doctors, then try and find previous doctors, okay? And be clear if treatment is planned, what those outcomes that are expected are going to be. So when you're talking stabilised, some of the common pitfalls are, if it's a condition that fluctuates, especially mental health, where you can have some really good stretches of time and you can have some catastrophic stretches of time, be really clear in the evidence how often it fluctuates, how badly it can get, and how long those periods of time where it's bad and bad enough to impact your ability to work, how long those periods of time last. Because if they last long enough to impact your ability to sustain work, then they will be adequate in order to show that you should be getting the disability support pension. So remember, if it's one of those conditions that are just never going to remain the same and remain stable, make it clear. Make sure the report shows it. You're not applying for a job. You're not trying to put yourself in the best possible light. You're trying to show the reality of your client's, life and day-to-day life. Okay. So, but also I see a lot of people that come in with reports from their previous, their most recent crisis moment, but nothing that's been written since. So nothing that's been written in that period of stability. So watch out for reports and watch out for evidence that hasn't been updated with that new current period of stability. So this is an example of a report that a client of ours received from their psychiatrist, and they their application was rejected. So I won't ask you to read the whole thing. I'll just show you where the problems were. If you have a look here, it says she would benefit from trauma-focused cognitive behavioural therapy, and she would benefit from seeking support from Health New South Wales. But the cognitive behavioural therapy was the really, really big flag there. But there's also an indication here that she would benefit from a change in medication. So this particular psychiatrist had only just recently started working with our client. Our client had actually been receiving specialised mental health treatment for a couple of decades before this. There was no treatment that was ever going to improve her condition to a point where she'd be able to work for 15 hours a week or more. And so we contacted the psychiatrist and asked if they would be willing to add a supplementary report. And this is what we received in return. Given her past history, her current level of support and other psychosocial factors and limited treatment response, I do not expect that further treatment would substantially improve her psychological or functional level to be able to work 15 hours a week or more. And our client was granted the disability support pension on this report. So top tips: diagnosed, treated and stabilised. Mental health conditions must be diagnosed by a psychiatrist or psychologist, with that rare exception. Ask your client if they're willing to share file notes from other practitioners like counsellors and social workers with psychiatrists and psychologists, to see if that might speed up that process and reduce the number of appointments with the specialist they might need. Look at other places where you might find evidence, like the NDIS applications that people put in. Contact with victim services, hospitalisations. They may have never seen a specialist outside of a hospital, but discharge summaries can contain diagnosis by specialist, and that might be enough. Contact with the justice system. Specialists can be they might have been incarcerated and seen specialists while inside, and compensation claims. So back to our flowchart. So we've got that non-medical criteria. Then we're going, do they meet that manifest criteria? And if it's a no, then they're looking at diagnosed, treated and stabilized. And please ignore that word fully. It's no longer fully, it's just diagnosed, treated and stabilized. And then if they are diagnosed, treated and stabilized, then is that condition going to last for 2 years? And if it will last, if it's not going to last for 2 years, then they're just not going to get the disability support pension. So you don't need to continue. Okay. So are there any questions?
Hi, Donna. Yes, there are a lot of questions. So we will start with, is there a grace period once obtaining a visa before being able to access Centrelink? DSP.
Look, we actually do, and I'm the one that does it. So we share the education sessions out between us all, but we do a 2-hour one of these on newly arrived residents and migrants, and it is a 2-hour session. That's not a quick answer. So yes, there are waiting periods, but it's going to be, it's different. Not everything has a waiting period, and the waiting periods are different.
And in regards to DSP, somebody actually is asking if there is an additional waiting period.
There is, and I'm pretty sure I'm talking about it at the end.
Okay.
If not, Bree, can you remind me at the end? If I haven't talked about it, can you remind me to answer that question?
Okay, will do. What is the minimum age that someone can apply for a DSP with an intellectual ability? Is
16.
it 16? Yeah.
16.
Okay.
Look, with an intellectual disability, in order to get points on that particular impairment table, which is the intellectual disability impairment table, my understanding is, but I've never seen this in practice, is that you need to have evidence from when you were a child. So, you know, that you have an intellectual disability. It's not, if you have a traumatic brain injury or a stroke or something like that as an adult that impacts your intellectual function, then it's a different impairment table. It's under one called brain. So yeah, but 16.
I know that you'll be touching on work and DSP soon. Somebody was wondering, as far as like a hobby income, if you were creating crafts and selling them, things like that, how does that affect DSP?
Look, almost every Centrelink payment has an income test. There is a particular amount per fortnight that you can earn without it impacting your payment. And then once you go over that amount, your payment drops by a certain amount. You know, until you're earning so much that your payment has dropped to 0. Each payment has a different income test, so I'm not going to go into each of them individually. But look, if you just pop into Google income test and Centrelink, you'll come up with, they're all there.
But essentially, you would have to declare it just like any other income.
You sure do.
Yeah.
You have to declare your income fortnightly. It's your obligation to update Centrelink with your income within 14 days, and to update Centrelink within 14 days of any changes that have occurred, including your income. So you must tell Centrelink about any income, but you can earn income without it impacting your payment, and you will always be able to generally you always be able to earn more than, you know, your payment will drop by sort of 50 cents in the dollar or 20 cents in the dollar, you know, for the income that you're earning. But as I said, you've got to look it up, each income test.
Eating disorders and DSP, would eating disorders come under psychosocial?
Yeah. Yes. However, if the eating, look, I imagine that if the eating disorder has had a permanent physiological impact on your ability to digest and things like that, if it's done a permanent damage to your digestive system, then there's a different table that you can look at as well, which is digestion and reproduction.
How does Centrelink consider being on a waiting list for an operation to be treated?
Yep. So if your treatment is not available within the next 2 years, or alternately, if the treatment and then recovery time is going to be longer than 2 years, then that's not reasonable treatment. Okay, you're not, they look at 2 year, for the disability support pension, it's a 2-year thing. So if your condition is going to last for 2 years, then that's what they look at. And if you can't get treatment within the next 2 years, then your condition is going to last for 2 years. Yeah. So, but you need to get evidence. That's one of the problems with this, is that they're not going to take your word for it, that something's that you have to wait for 2 years. You need to get someone to put it in writing that the waiting list is 2 years, or that the waiting list is 20 months and the recovery time is 6 months. So just remember, with all of this, you need evidence. They're not going to take your client's word for it.
Okay, so just do one more, if that's all right, and keep moving. How recent do documents of evidence need to be?
So that's a change that's come about since that 1st of April 2023 relaxation of the criteria. What we're seeing is that prior to then, Centrelink needed evidence that was dated within the previous 2 years before the application, that you had to have, your evidence had to be within the 2 years before you lodge the application. We're seeing that that isn't the case anymore. We're seeing people granted for the DSP when they're providing evidence that is significantly older, and they sometimes aren't providing evidence within the last 2 years. So it is just, it's less like it now, it is less when is it dated, it's more, are they reasonably treated? Are they stabilized? And do they have the evidence of a diagnosis by the appropriate specialist or medical practitioner?
There's a lot more questions, but we'll keep moving and we'll come back to them in the next question section.
Great, no worries. Okay, so our next case study.
So just looking again to another part of the report, Andrew, where you talk about, well, you've suggested that Mariam should be given 20 points on the impairment tables.
Yeah, that's right. Well, according to tables, she should. Her mental health has deteriorated to the point she can't function well enough to get things done in a workplace.
Okay. Yeah, so I think, so this section could probably do with a little more work because of the way that Centrelink wants to receive information. So basically, Centrelink isn't really interested in your view about what points you should receive on the table. Rather, what they're looking at is for you to describe the impact of those conditions, so they can decide from themselves, based on your description of the impact, how many points should be assigned.
Right. So what do we need to do?
I would have 20 points, possibly even 30.
Yeah, it looks that way. So just to your question, Andrew, so you'll see in the mental health tables, there are 6 different areas that they consider, including self-care and interpersonal care.
Yeah, I've got the table open. I can see the list.
Yep. So it'd be really useful if you could talk to Mariam about each of those 6 areas and included a sentence or 2 in your report addressing it.
What do you mean?
So example, looking at self-care and independent living, say, for example, if Mariam isn't eating properly or isn't cleaning or washing properly and is relying on external support, then you'd include a sentence to that effect.
Mm-hmm.
Or in relation to the second category, which is about social activities and travel, if Mariam isn't easily able to get around independently to social events or go to places that she hasn't seen before, you can include a sentence on that.
I can't get to the shops without my family even, or the support person. I mean, I can get to the corner shop maybe, and I could come here, but nowhere else really. I couldn't do it.
Okay, well, that's all very relevant, and Andrew can include that in his report. So it'd be very helpful to put that information in the letter. And Andrew, it's still fine, by the way, to state your opinion about what impairment rating Mariam should receive, but the main thing they're focusing on is what is the impairments, and they're looking for a description of the impairments as against the impairment tables in order to make an assessment. Okay?
Okay, yeah, I'll give it a go. Thank you.
Great, thanks Andrew, thanks Mariam.
So once you've been found to have that diagnosis, that you've attempted or completed all reasonable treatments and that you're stabilized, it's only at that point that they start thinking about whether you might be eligible for the DSP. And by what they do is they look at how your disability impacts your day-to-day life, what it prevents you from doing, what it makes difficult for you to do, and how it might impact your ability to work. So they recognize that everyone's disability will impact them differently. So merely having a diagnosis isn't enough to get you the disability support pension. And the thing about it is that they don't just take the applicant's word for how their day-to-day life is. They will listen to them, and that's really important for the applicant to provide that information, but they need supporting evidence. So they need supporting evidence from a doctor, from a support person, from other people and other sources. And they use a point system, and you need to get 20 points in order to be granted the disability support pension. So there are 15 different impairment tables that look at the different parts of the human body, or the different ways in which the human body functions. And those impairment tables each have the option to give you 0 points, 5 points, 10 points, 20 points, or 30 points for each table. So it's possible to get your 20 points from a single table, or you might get those points added up across multiple tables. So you might get 5 points from one, 10 points from one, and 10 points from another. And with those three tables combined, you ultimately have your 20 points of impairment. So I'm not going to be going through all of these tables in detail, but please read them. It's really, really, really important to know all of the tables that are available, because some of them are more commonly used than others, and you might find that you have clients that actually fit under some of the more obscure and lesser known ones. So just be aware that there are 15 different tables. So the reason that I say please be aware of all the different tables is this is an example of one of our clients. They came to us because they'd been rejected for the disability support pension, and they came to us and said that they have depression, anxiety, and arthritis. So we spent a lot of time with them talking about the depression and anxiety and arthritis. And it wasn't until a long way in, quite a few appointments, that he mentioned that he also had a urinary incontinence issue. He was far too embarrassed to talk about it. He didn't think it was relevant. He didn't want to say anything about it at all. Now, with his DSP applications, he'd applied 3 times. He got 5 points for the arthritis and 10 points for the mental health, and they were correct. His conditions weren't impacting him in a severe way. He weren't impacting him enough to get 20 points under either of those tables on its own, and it wasn't possible to get 10 points under arthritis. 5 points was all he was ever going to get, but he was eligible for 20 points under the impairment table for continence. but his GP didn't know that it existed, wasn't aware of it. You know, hadn't talked to him about it, hadn't given him the evidence. He'd been to a specialist, he'd been to a urologist, he had everything he needed. He just didn't give it to Centrelink. So as soon as we realised and the information was given to Centrelink, he was granted the disability support pension, and because he'd appealed in time, he was back paid to the date that he first applied for his most recent application. So remember to look at those more obscure tables, and remember to, you know, talk to your clients. Okay, so just to have a little bit of a closer look at those impairment tables, so you got a bit of an idea about how they're talking about impairment and how they're talking about day-to-day, you know, people's day-to-day life. So table 1, functions requiring physical exertion and stamina. You know, you get 0 points if they can exercise for 30 minutes. Okay, and they have, you know, not much difficulty doing those day-to-day jobs around the house. Okay, so, but you get 5 points if there is an impact. So one of the things that it's important to note on these new tables is that they recognize what they call post-exertional malaise. So where you're having to take recovery time. You can do something, but after you've done it, you're having to recover and have recovery time. So the old tables didn't have that. So they're looking at shortness of breath, fatigue, pain, post-exertional malaise when doing different things like walking around shops. Can they climb a flight of stairs? Can they vacuum? Can they mow? Yeah. 10 points needs difficulty, sort of that moderate difficulty, and they're looking at similar things. They're looking at how they can walk around and get out, how they can do day-to-day activities. Can they catch public transport? Can they walk around the local shops? Okay. You get 20 points with it when it's a severe issue, where you're having long recovery periods after doing light household activities, where you need assistance. So if you'll notice in the impairment tables where they use that word assistance, so walking or mobilizing around from a car park and around local facilities without assistance. Assistance is assistance from another person. It's not assistance from a wheelchair. It's not assistance by leaning on a shopping trolley. Assistance is another human being. Okay. And then finally, 30 points is being completely unable to do anything. Okay. And that this impairment level includes people who require oxygen. Okay. So just to give you, just as another one that's a common one, but I thought I'd just give you a bit of a look at it, is the mental health impairment table. So for 20 points on the impairment table, you need to be showing that 4 of these categories is an accurate description of your client's day-to-day life. You know, so you need to have a majority of them, so 4 of the 6, and it's self-care and independent living. You need phone calls or visits from someone at least twice a week. Or if you're not getting that, you can provide evidence that actually you're not functioning. So maybe you're not eating, you're not cleaning yourself, you're not cleaning the house, you know. That social recreational activities, interpersonal relationships, travel and accessing the community. So you can't travel on your own unless it's somewhere familiar. You know, you don't use community facilities. You can't struggle with public transport. You know, you can't concentrate for more than 10 minutes. The medication that you're taking is impacting your movements and your action times. Maybe you have anger management issues, or, you know, you difficulty controlling your emotions. You struggle to plan, you struggle to make decisions. Okay. So, top tips. When you're looking at the impairment tables and when you're looking at evidence of someone's functioning day to day, you do not have to go to a specialist. Okay. So a GP is fine. Your support person is fine. Getting evidence from that person that maybe assists you, whether it is a family member, whether it is an external paid support person, that's great and that's fine. You know, you don't have to necessarily pay for a specialist. Okay. If you get someone that organizes their evidence in the same way that the impairment table is organized, if you get someone who quotes those impairment tables, then that makes it easier for Centrelink to make the decision you want them to make. Okay. The other thing is, be really specific, be detailed. Don't say such and such has severe difficulty with doing household tasks. It takes this person 2 hours in order to make their bed. They will put 2 corners of a sheet on and then have to sit down and rest. Then they will need to go back and do the other 2 other corners. Then they need to rest. They're completely unable to put the cover of a quilt on themselves, and they don't change their quilt cover more than once a month because they need to wait for someone to visit in order to help them. So give examples. Paint that picture, be specific, okay? If you are getting evidence from the GP, then make a long appointment and sit with them while the GP writes the evidence, because there's no Medicare line item for GPs to get reimbursed for the time they spend writing DSP reports. So the only way that they might be able to get money back from Medicare for the time they're taking to write these reports is if it's during an appointment, they give you a checkup and they can claim that time from Medicare. Okay. But also remember, you might have a single impairment or single disability or a condition, but actually it impacts a lot of different tables. Then provide evidence for all of those tables, because you might get points on all of them. A really classic example is multiple sclerosis. You know, multiple sclerosis covers most of the tables depending on how it's presenting. Okay. But the flip side of that is that you might have lots of conditions that impact a single table, and that can get a little bit tricky if they can't separate out what the impact of each is, and one of those conditions isn't reasonably treated yet. But also be aware that you will rarely get points under Table 1, Physical Exertion and Stamina, which looks at pain and a condition that impacts a very particular area of the body. So maybe you've got arthritis of the spine, and because of that you struggle to bend or look up or do things with your spine, but you're also in pain. You will get points on either the spinal table or Table 1 for that one condition that impacts that one area. You won't get points on both. So, couple of quick examples of reports that we've seen that give evidence of impairment. This one here, it's a single sentence under each table. So you've got upper limb function, just a single sentence, lower limb function, single sentence, and then spinal function, single sentence. And that was enough to get that person the disability support pension. That was enough to get them evidence of points and get them on. Another example, though, was a significantly more fulsome, report that had, a lot of information, a lot of detail included, and that was enough to get that person onto the disability support pension. So just because it's short or just because it's long doesn't mean that it is what's needed, it's what's included. Yeah, that is what's needed. So we're back to our flowchart. So that non-medical criteria, income, assets, residency, then manifest, and then Is the condition diagnosed, treated and stabilised? Is the condition going to last for 2 years? Then, do they get 20 points on the tables? And there's a couple of options here. Do they get 20 points from a single table? Do they get 20 points scattered across multiple tables? Or they've got a condition, it's impacting them day to day, but it's not impacting them enough to get them 20 points on the tables at all. And if it's less than 20 points, then it's no. You don't need to continue. They shouldn't be spending more money and time and stress on going through this process. They're not going to get the disability support pension. Okay, but if they get 20 points from one table or 20 points scattered across 2, then it's worth continuing on and looking at the next steps. Okay, any questions?
Hi, yes, lots of questions again. Okay, so if somebody has a mental health diagnosis such as schizophrenia, does Centrelink still expect to see that that person has tried therapy as a form of treatment?
Look, it is what is reasonable for that particular condition. They're going to want to know, they're going to need to see evidence that there is no treatment that will improve their condition to a point where they would have the capacity to work 15 hours a week or more within the next 2 years. Because the mere diagnosis of schizophrenia is not enough to get you DSP. There's no manifest eligibility for any mental health condition. Okay, you still have to go through that diagnosed, treated, stabilized process. So if therapy is what's normally recommended for schizophrenia, and I have to say off the top of my head, I don't know, then yes, they'll need to see therapy. Schizophrenia, they're going to need to see medication. They'll need to see medication considered, I imagine.
Does being a member of a couple affect DSP?
Being a member of a couple impacts the rate of payment you get. So most payments have a singled rate of payment and a coupled rate of payment. So just the standard amount you get may be less, depending on which payment that you're applying for. But also the other member of a couple's income and assets are considered and taken into account in any income and asset tests. So the income of the other party is treated differently, but it is still assessed and it will still impact the payment that you receive.
Is substance addiction considered a disability?
Yes. So table 6 is functions of, I can't remember the name, but essentially it's drug and alcohol substance use disorders.
Okay. Are medical specialists and GPs offered training on the DSP requirements?
I'll talk to anyone that wants to talk to me and I'll train them. But I don't believe that Centrelink offer training. I don't know if there's any training available through the the colleges. Yeah.
Yeah.
But my understanding is that there isn't.
Okay. Under the new requirements, can people in receipt of permanently blind DSP still work full-time without their payment being affected?
That's my understanding, but I'd have to go and look it up.
Would you have a recommendation of how to approach DSP for young people? Doctors can be reluctant to say conditions such as mental health issues is permanent.
Look, sometimes it can just be less having, in some situations, you don't necessarily need to have a doctor going, this is it, there is nothing. If you can show through the weight of history. So you might have a young person who's been hospitalized multiple times, who's been having therapy, weekly or fortnightly for years. Then even if you don't have a specialist saying that this is permanent and there will be no improvement. Showing a long history of treatment, showing a long history since they were first diagnosed, and then having a support person or someone else, as I said, it doesn't have to be a GP, providing evidence of that day-to-day impact of the condition. That might be enough to get the DSP granted without having that single line in a report from a specialist or a GP saying that, you know, this is it. But if you have a specialist report saying that this person will benefit from XYZ treatment, then you are going to struggle to have evidence from someone without that level of qualification counteracting that to get over it. So I had a client who had a cardiac condition and whose cardiologist wrote a report saying that they would benefit from, I can't remember what the treatment was now, but would benefit from such and such. They had a GP saying that there was no treatment available and that this was their day-to-day impact. But Centrelink went, no, GP doesn't know as much as a cardiologist. The cardiologist has said you can benefit. The cardiologist has said you're going to get better. I'm not taking the GP's word. So it sort of is a bit of a case-by-case basis.
Okay, so we just do one more and we better keep moving because we're running out of time. We have covered this, but there's a lot of people that would still just benefit from further clarification regarding support letters and reports. Social workers versus psychologists, mental health therapists, what's the best course of action?
People requiring the disability support pension usually have very few funds. They can't afford, you know, they can't afford it. They can't afford the specialists, you know, if they're having to pay private. If you can get a psychiatrist or a psychologist writing a report that covers diagnosed, treated, stabilised and day-to-day impairment, if you can get a urologist, a cardiologist, you know, those specialists writing it, fantastic. That's, you know, that's gold standard evidence. That's brilliant. But that's not most people's reality. That's not most people's life. Trying to get that specialist appointment and affording that specialist appointment isn't an option for most people. So get the evidence you can get. And, you know, get the, you know, I've been very successful for some of my clients with having the client writing a detailed statement about their day-to-day life, having a client's partner write a detailed statement about what assistance they give. Because remember those tables that say, can they do something without assistance, and that assistance being from another person. So having the person providing that assistance, writing a signed statement or a signed letter saying what that, you know, what they see, what they observe, what they're helping with and why they're having to help with it, what it would look like, you know, if they weren't there to help. You know, that's been great. I'm going to be going through later on the different resources that we've got available, and we've got resources available on our website that are templates, and you can get your GPs and, you know, support people to use those templates, and that might make things cheaper and easier. But I really do. One of the reasons why I want people to really understand the disability support pension is because I don't want people to try and pay money and go through that incredible stress of trying to get evidence that's not necessary. You know, it's expensive. I don't know, did that answer the question, Bree, do you think?
Sorry, on mute. I believe so. I think, yeah, people just wanted to know exactly, you know, what was the best course of action. I think you covered that. So thank you, Donna.
No worries. Okay, we're going to have a 5-minute break. We'll be back at 3:05 for the second half. Just to restate what's already been stated. And I'm sure anyone that's seeing the numbers in the chat, you know, constantly going up, there's a huge number of questions coming in. We're trying our best to answer as many as possible. It's impossible. We will never be able to answer every question because unfortunately we have a lot of people attending these sessions, but we are answering as many as we can. Okay, so we have another case study.
Hello, is that the solicitor?
Yes, I am. I understand you're having issues with your disability support pension. Are you able to tell me what's happening?
Yeah, well, I've tried to get on the pension. Gave Centrelink all my medical evidence, but they've said I can't get on, and I just don't know what to do.
Oh, no worries. You said you gave them your medical evidence. Can you tell me what medical issues you have?
Yeah.
Oh, I'm so sorry.
I've got rheumatoid arthritis, which they don't seem to care about, although it's quite debilitating. And then I've got a sort of breathing difficulties, which makes it hard to walk upstairs, and I've got a bit of a cough, and then also recently I got diagnosed with severe depression and anxiety because my husband passed away, and I've got a son, but I don't want to, you know. He's got 2 young children, so I don't feel like I can call upon him. So I just feel like I'm doing this on my own, and I really need to get the pension.
Yeah, sure. Look, you said that Centrelink has told you you're not eligible. Have they made a formal decision? Have they assessed it and given you any formal information?
Yeah, they sent me a letter telling me that I wasn't eligible, but I could appeal against the decision if I wanted to.
You said they sent you a letter. Do you have it there in front of you? Are you able to tell me what it says?
Yeah, sure. It says everything I have, it's fully treated, diagnosed and stabilised, and then they gave me some points.
Does the letter tell you what points they gave you and for what?
Yeah, sure. For the rheumatoid arthritis, they gave me no points because they said there wasn't any functional impact, which is ridiculous because it's terrible and stops me from doing things. Then the chronic obstructive pulmonary disease was a moderate functional impact and gave me 10 points for that. And then for the depression and anxiety, got a further 10 points.
Okay, look, you've got 20 points overall. So that's actually your first hurdle. That's the first step you've got to take in order to get onto the disability support pension, is to get those 20 points.
Right.
Look, does the letter tell you anything else? Does it mention anything about program of support?
Oh, yeah, well, that's the reason they said I can't get it, because I haven't done one. But I've never heard of a thing called a program of support. And, you know, how can I look for a job the way I am? Don't know.
So having a look at that one, we've got that application for the disability support pension was rejected, and they've obviously provided sufficient medical evidence because they were found to be diagnosed, treated and stabilised. They have 3 conditions. Centrelink found that the rheumatoid arthritis wasn't actually impacting them, and 0 points. They have the breathing difficulties, the coughing and the difficulty walking upstairs was only moderate, so 10 points. And then the depression and anxiety was moderate and only 10 points. And she was told she needs to do a program of support, and she can't look for work. She has no idea how she'd possibly be able to look for work. Now, the thing about this situation is that most people, if they get that letter, or if they get told that over the phone by Centrelink, being told that they need to do a program of support, it's the first time they've ever heard those words. They have no idea what a program of support is. They've never been told about it. They wouldn't know how to go about doing it. And it's completely new and bewildering to them. Okay, so a program of support is support provided by a Commonwealth-funded employment services provider to assist you to improve your chances of finding and maintaining paid employment. Okay, so you need, if you get 20 points on a single table So you have a severe condition that gets you 20 points on one table. You don't need to do a program of support. But if you get 20 points scattered across multiple tables, 10 points on 2 tables, 5 points on a few different tables, however it happens, if you're adding up your 20 points over multiple tables, then you must have done a program of support before you lodge your disability support pension application. Okay. So if you haven't completed, well, you can be exempted from a program of support, but if you're looking at whether you've actually completed one, you need to have done your mutual obligations for 18 months. So you need to be engaged with a job network provider, and you need to be doing everything they're saying for 18 months before you lodge your application. If you're making applications to be exempted, so if you're getting those medical exemptions that usually last for 3 months at a time, then that period of time when you're on a medical exemption does not count. It is not included in any program of support. And you need to, so you've got 3 years to complete that program of support. You've got 3 years to do those 18 months. So you can have those medical exemptions during it, but you need to have finished 18 months before you lodge your application, or you need to have finished the program in less than 18 months and to have evidence of having done that, or you need to have your job network provider say that you've been exited, or there is no benefit to you to partake in a program of support because there's no way that they can improve your chances of finding work. Okay. So you can get a letter from your job network provider to say that that you've participated, but they were never going to be able to improve your chances of finding work, and that you should be exited from the program of support and shouldn't be required to do it. Some job network providers have are more willing to write these letters than others, but they're always, they're legally within the legislation, they're able to write the letters. There's also some forms that you might be able to find online that previously were used by Centrelink. There's one done by the Department of Human Services. So, it's quite old, but you might be able to find, job network providers might be more willing to fill out those forms. So if you're going to get a letter from a job network provider, then there's certain things that it's helpful to have those letters include. The employment services provider's details, what months, dates, years that the applicant was actually engaged, when they weren't engaged, when they were exempted, why they were exempted, why they weren't involved, whether they were compliant with the terms of their mutual obligations and how often they had contact. So this is an example of a letter that we've seen that was fine for showing Centrelink that they should have been exempted. Okay. So top tips for program of support. If you've got a client who otherwise has the evidence to show that they're eligible for the DSP, but they're on one of those temporary medical exemptions, don't lodge. Wait until the client actually re-engages with their job network provider and then lodge. Okay. If you're looking at it and they've got points scattered across multiple tables, but they've essentially done no mutual obligations, and it's going to take months or years, full 18 months before they're going to have completed a program of support, then start looking at whether they should be getting 20 points on a single table instead. Yeah. Is there any chance that you can bump up one of those tables, find evidence somewhere to show that they've got a severe condition instead of a moderate? Okay. Talk to the job network provider, ask for one of those letters. Okay. The job network providers don't make the decisions, but they can write those letters to recommend that Centrelink makes the decision to exit them. And the thing about a program of support is that it's in the legislation that it must be government funded. So that means it is those job network providers. Any training, support, all of that done by any organisation that's not Commonwealth funded doesn't count. So training and support done while incarcerated doesn't count. Okay, TAFE and uni in and of itself doesn't count unless the job network provider has included attendance at TAFE or uni as a part of the mutual obligations. Okay, so common pitfalls for program of support issues. Support workers, GPs really pride themselves on getting those medical exemptions. You know, they will fill out that you know, is it SU 415? They'll fill out that certificate, you know, very, very happily to help you to apply for a medical exemption. But it can mean that you're not going to be able to get the DSP. It can really impact your future access to the DSP. So don't just automatically apply for a medical exemption. Be aware of the issues it can cause. Okay. If you lodge an application for the disability support pension, then your mutual obligations can be suspended from the day that that application is lodged until the day that the decision is made to either grant or reject your application, that first decision. Okay, so but they don't do it automatically. You have to ring them or you have to contact them and ask to be exempted. And if for some reason while you're still waiting for a decision and that exemption ends, you just contact Centrelink again and go, hey, I'm still waiting for my decision on my DSP. Can you please exempt me for longer because the decision's not been made yet? Okay. The other thing is that mutual obligations can be tailored and they can be adjusted to your abilities, to what you have the capacity to do. So try and get them to help them to do that. Okay. So program of support. Don't bother appealing a rejection if they haven't done that 18-month program of support and aren't getting 20 points on a single table. Get their mutual obligations adjusted, get a letter to say that they should be exited, and then lodge a new application. Okay. If you get those mutual obligations adjusted, it can be down to as little as a single phone call every 3 months. Okay. And you're still engaged, you're still doing the program of support, you're still doing your mutual obligations, and it's within your abilities. Okay. So the way to get those mutual obligations adjusted, the way that Centrelink assess what your capacity is through an employment services assessment or a job capacity assessment. So ask your client whether they've had an employment services assessment. If you haven't had one within 2 years and you ask for one, then Centrelink must arrange for one to happen. If you have had one in the last 2 years, then Centrelink might just say yes anyway, or you just might need to get evidence from the GP to say that a new one's needed. And that employment services assessment is used by the job network providers to tailor your mutual obligations to your abilities. Okay. All right. So the final step in our flowchart is once you've you've got your impairment level, you've looked at whether a program of support is an issue or not. The final thing that Centrelink looks at is whether you have what they call a continuing inability to work. Do you have a severe impairment? Have you got 20 points or more on a single table? Have you participated in a program of support if you don't have a severe impairment? And do you have an inability to work or train within the next 2 years as a consequence of your impairment? is that impairment that they're looking at preventing you from working for 15 hours a week or more. So if you have someone who has the capacity to work 15 hours a week, they will not get the disability support pension no matter how many points they get. They might get 50 points on the tables. They won't get the DSP. You need to have an ability to work for 14 hours a week or more. 14 hours a week or less. Anything over that, you won't get the DSP. Okay. And that job capacity assessment is where they assess how many hours a week you have that you're able to do. Okay. So top tips with that 15 hours a week or more continuing inability to work. If you get a job capacity assessment that says that you are going to have the capacity to work for 15 hours at some stage in the next 2 years, you can appeal that as a separate decision, separate to the disability support pension. Okay. Same with the employment service assessment, as I've already said. If there's a job capacity assessment that's older than 2 years, it can be redone, and it must be redone if it's asked for. Continuing inability to work is only that disability and what it prevents you from doing. They do not look at whether you would be offered a job or not. They don't look at what your work experience is. They don't look at what work is available in your area. They don't look at whether you might have literacy issues. They don't look at your criminal record. None of that is relevant for whether you have an ability to work for 15 hours a week or more. Okay. Another thing as well is check if they've been lying to their job network provider and saying that they're working 15 hours a week in order to not have to do any mutual obligations, whereas actually they haven't been doing those hours and they don't have the capacity to do it. Okay, so that can be a trap that people fall into. But also someone might be working 15 hours or more a week, but they are taking an enormous amount of sick leave. They're taking an excessive amount of sick leave, far more than would be normal and reasonable. And that sick leave can be evidence that even though on the roster or the pay slip, they're down as 15 hours a week or more, they actually don't have that ability to work for 15 hours a week or more because they're getting sick. And they're having to take annual leave and sick leave and unpaid leave and all of that in order to stay at that job. Okay, so let's get back to our flowchart. So this is the end of the flowchart, and hopefully it now makes a bit more sense, and hopefully it might be a little bit useful. So do they satisfy that non-medical criteria? Yeah. Have they, that income, assets, residency? Yes. Have they got a manifest grant of DSP? The terminal illness, the blindness, the category 4 HIV AIDS, the intellectual disability of 70 points or less. Yeah. No, they don't. Then maybe they might still be eligible for the DSP. Is their condition diagnosed, treated and stabilised? Is their condition going to last for 2 years? And do they get 20 points on the impairment tables? And if those are all yes, then do they get 20 points on a single impairment table? Then you jump straight to, do they have that continuing inability work of 15 hours a week or more? Or alternately, are they getting their 20 points scattered across tables? Do you need to look at whether they need to do a program of support, and it's at that point when they've gone through that, then you look at that continuing inability to work. And if you're ticking all of those boxes and you've got the evidence to show it, then your client should be getting the disability support pension. Okay, so I mentioned earlier that there are resources available to help people. So there is a fact sheet that runs through the basics of the disability support pension that is on Economic Justice Australia's website. Social Security Rights Victoria has a medical evidence bot called DSP Help. You put in a whole load of all sorts of information, and it prints out, it creates a letter that you can provide to your doctors that tells them what you need and what evidence is needed. Okay. Our website has a huge number of resources available on it. Follow the link to how do I get the disability support pension, and you're going to find in here a letter that you can, an introductory letter to the doctor. You'll get those template letters that I was talking about that you can fill in order to show what evidence you need. And we've also got copies of those 15 different impairment tables there. So if you're wondering what they look like, if you need them, then pop to our website and you'll find all 15 there. There's also links to the Services Australia website for more information that might be useful. So you follow those links and this is what it will look like. As you can see, there's the 15 different tables, and then there's also those treating doctor reports. And the treating doctor report, the template treating doctor report looks like this. You know, basically, it's a fill in the gaps and tick a box for your doctors. So it means that if they do complete it, then everything should be there. There should be evidence of the diagnosis by the appropriate specialist. There should be evidence of what the treatment history is. There should be evidence of what treatments they're going to be doing in the future, but also what the expected outcomes of those treatments are. As well as there's evidence of what the day-to-day impact of the condition is as well. All right, so questions?
Hi, Donna. Sorry, I'm just pulling them up now. Okay, we have a lot of questions again.
Good.
Okay, so is the payment logged from when you first speak to Centrelink via the phone or in person, or is it when you lodge the application?
Look, unfortunately, for most applications and for the disability support pension, it is from the moment you press that submit button or from the moment that you hand over the paper application form. It is not, you're not back paid to the day that you first chat to Centrelink about it or raise the possibility that you might in the future or might at some stage lodge an application.
Okay, when somebody has applied for DSP and they're still attending job network appointments, what should the doctor write on the medical certificate for exemption? The person that wrote this question thought that it was temporary exacerbation of permanent condition, but Centrelink would not accept this.
So that's what we advise. So, I mean, we advise... We advise people to tell, you know, the truth about what their condition is. If you have if you are wanting a temporary exemption from your mutual obligations and you have a permanent condition, when you're looking at medical conditions in this situation, a permanent condition is one that is going to last for 2 years. If you have a condition that's going to last for 2 years, then Centrelink will not give you an exemption because they expect your mutual obligations to be adjusted to accommodate your abilities. They won't give you an exemption for something that is permanent. Okay, but if you have a temporary condition, then they will give you an exemption. And if you have a permanent condition that is for a period of time significantly worse, so you have a mental health condition and you're going through a mental health crisis, you know, or something along those lines, then for the period that it is temporarily worse, then Centrelink should be giving you an exemption from that, from those mutual obligations. If they do not give you an exemption, if you have lodged an application and said that it's a temporary exacerbation of a permanent condition and they say no, it's a decision that you can appeal. And you can contact Centrelink and say, I'd like to appeal the decision to reject my application for a medical exemption. And you can also go back to your doctor and see if you can get more evidence.
Okay. How do you meet your program of support obligations if you have been incarcerated?
When you are released, you start your program of support. Unfortunately, it's yeah.
When considering whether all reasonable treatments have been tried that may impact the capacity to work, does this also include the potential positive impact of NDIS funded supports?
In my experience, I have not seen Centrelink say, you've just been granted NDIS, and so therefore we're going to be rejecting your application for the disability support pension, which is not to say it hasn't happened or wouldn't happen. I've just never seen it.
Is a job capacity assessment required for any client applying for DSP, or just those who have not met 20 points in one table?
So my understanding of the process of Centrelink making a decision internally about whether someone's eligible for the DSP, and I have to say this is just my understanding from looking in at the outside, and it doesn't happen every single time. People might be granted or rejected at any point along the way. But my understanding is that you lodge an application, there is an initial assessment, there's initial medical assessment to see whether there's a possibility that a person might be eligible. And if it's decided that there is a possibility that they might be eligible, then it then moves on to a job capacity assessment. And it's in that job capacity assessment that points are recommended, that it's ascertained whether they are diagnosed, treated, stabilised, and it looks at a person's continuing inability to work. And if at the end of the job capacity assessment it looks like they might possibly be eligible for the disability support pension, then it moves on to a medical assessment by an external medical professional. Sonic Health is my understanding is who has the contract at the moment. As I said, this is me looking in for the outside. And then once Sonic Health has done an assessment, it then goes back to the person, the original decision maker, or that officer, Centrelink officer, to make a decision about whether someone is eligible for the DSP. Someone may be granted or someone may be rejected at any point along the way.
I believe you have answered this, but people are seeking clarification. When somebody is on JobSeeker and they apply for DSP, when do the mutual obligation exemptions start?
They don't automatically start. So from the moment that an application is lodged, a person is eligible to contact Centrelink and request that their mutual obligations be suspended, that they be exempted from their mutual obligations until a decision is made. But that's not automatic. You do need to request it, and it's on the day that it's lodged that you are eligible to make that request.
Okay. Sorry. I believe this has been answered, but do the same rules apply across the states? Queensland, New South Wales.
So the thing about Centrelink and the disability support pension is it's federal law. And so that means it's universal across the whole of Australia.
If you study for more than 15 hours a week, is that considered proof of being able to work more than 15 hours a week?
It may be, yeah. Yep.
Okay. Is there a period of review for DSP eligibility for some conditions, or are some conditions never reviewed?
Oh, so if you've been granted, I'll make an assumption that this is what the question's asking. If you have been granted the disability support pension, then you may be reviewed at any point to see if you are still eligible for the disability support pension, and it can be at any point in the future. So you may have been on the disability support pension for 20 years and you may be reviewed, or or less, or I do not know if there are any conditions where you will never be reviewed. I imagine that a manifest grant for intellectual disability, blindness, HIV, you would be, I imagine they probably wouldn't review. I have been told by an authorised review officer that it's random. It's a random thing. However, if you have someone, you're able to work when you're on the disability support pension. You need to be unable to work for 15 hours a week or more to get the disability support pension. But after you are receiving the disability support pension, if you improve to a point where you have the capacity to work for more than 15 hours a week, you can work up to 29 hours a week and not lose the disability support pension just because you have that capacity to work for 29 hours, but you might lose it if your income goes over the limit. I have no idea if this is the case, but I would imagine that if you are working for 29 hours a week for a really long time, then Centrelink might go, I wonder if this person really is eligible for the DSP anymore. But I don't know if that is actually what would happen. I don't know.
Okay, somebody would like to know about being able to access your ESAT report if you have an intellectual disability.
If you want a copy of your ESAT, your Employment Services Assessment, or your Job Capacity Assessment, your JCA, you just need to walk into a Centrelink office, walk up to the counter and ask for them, and they'll give them to you. And if they don't, then you can appeal that decision, because they should just be able to give it to you, or ring them and ask.
Is it ever helpful to ask for the information on file with Centrelink about what program of support engagement your client has had as part of a freedom of information request, perhaps?
Yeah, go for it. You might also just be able to ask your job network provider if they are able to give you that information.
If a GP hasn't made the original diagnosis, how will they know which tool was used for the diagnosis?
Yeah, so then you need to get evidence of the diagnosis. I think it possibly is a little bit of a, it might be more specific, because if you need to get evidence of the diagnosis by the appropriately qualified specialist. If the GP is the appropriately qualified specialist, then they will have the tool that they use to diagnose. If they're not the appropriately qualified specialist, then you need evidence of that diagnosis by the person that is qualified, and hopefully that evidence will include the tool. Yeah. I don't think that was very helpful. Sorry about that.
Okay, so should we do the rest of the slides and then?
Sure. Look, and if we finish in time, I will just answer questions until we hit 4 o'clock. So, okay. International agreements. There are agreements that exist between Australia and other governments. And if there is an agreement between Australia and another country's government, then it is possible to, lodge applications from within that country or to travel to that country. There's all sorts of things. You've got to look at those individual agreements for the individual countries. But one of the ones that we most commonly see, and that's an important one to know about, is the New Zealand agreement. So there's an agreement between Australia and New Zealand. You can make an application for the disability support pension if you are a New Zealand citizen and not a permanent resident of Australia. But in order to get the disability support pension as a New Zealand citizen, the disability has to have arisen either when a citizen or resident of New Zealand or after arriving in Australia. If you are a citizen of New Zealand, but you were your disability arose in another country before you arrived in New Zealand and before getting New Zealand citizenship, then you cannot get the disability support pension in the Australian agreement. It is a lot stricter to get the disability support pension through this agreement. You have to have 20 points or more on a single table. You cannot have a condition that gets you 20 points across multiple tables. And you also need to have a continuing inability to work of less than 8 hours rather than less than 15. Okay. So do you remember right at the beginning, someone asked about waiting periods, and I said, I'm probably going to be talking about it later. This is the waiting period that is specific for the disability support pension. You have to wait for 10 years before you can get the disability support pension in Australia. You need to have resided in Australia for 10 years in one stretch, or in multiple stretches adding up to 10 years as long as one period is of 5 years. The only exception to having that 10-year wait is if that inability to work, that reduction in your capacity to work due to a disability to a point where you're unable to work for 15 hours a week or more happened after you arrived in Australia. So you needed to have that inability to work happen in Australia in order to get an exemption from that 10-year waiting period. Okay. You can travel when you have the disability support pension, but you can only continue to receive the disability support pension for 28 days when you're outside of Australia. And that 28 days is in a rolling 12-month period. So it can be 28 days in a single stretch, or it can be a couple of trips of less than 28 days. But the moment you hit 28 days in that 12-month period, no matter where that 12-month period rolls from and to, you will have your payments suspended. And if you're outside of Australia for 13 weeks after your payment is suspended, your disability support pension will be cancelled, and you will need to lodge a new application after you arrive back in Australia, because you won't be able to just have that disability support pension restarted if your payment is cancelled. If it's suspended, you can just have it restarted when you arrive back in Australia. Now, it is possible to apply to have indefinite portability, to be paid the disability support pension overseas indefinitely. However, do not lodge this application without getting legal advice first. It is incredibly important that you don't. There is incredibly strict criteria to get access to it. And by applying for that indefinite portability, Centrelink will essentially review your eligibility for the DSP from scratch. And we have seen people apply for the DSP, had their eligibility for the DSP reviewed, and had their payment cancelled because Centrelink has decided that they're no longer eligible for it at all, let alone eligible for portability. Okay, so get legal advice before you lodge that application. All right, so we've already had a question about being reviewed. So you can be, as I've already mentioned, you can be reviewed to check if you're still medically eligible for the DSP. If you're found to be no longer medically eligible, you get 6 weeks notice. Okay. And so you'll be paid DSP for 6 weeks only. And common triggers, as I've already said, is that being application for indefinite portability to be paid overseas indefinitely, and regularly reporting income from working more than 15 hours a week. Okay. Exemptions from mutual obligations. I've already answered these questions, but you need to have, you can only get an exemption from mutual obligations if it is a temporary condition or that exacerbation of a permanent condition. And then you can get that exemption after you've lodged the application. But look, if you do get that decision and your application's rejected, then you can't get an exemption from the mutual obligations while you're going through the appeals process. Okay, so appeals process, you can appeal a rejection of an application for the disability support pension. Okay. The process of appeals is you get that original letter, you get that original decision. If you disagree with that, you appeal to an internal level, the authorised review officer. And if that's rejected, you can then appeal to the Administrative Appeals Tribunal, the Social Security Division, and then the Administrative Appeals Tribunal General Division, and then finally the Federal Court. Just be aware that the Administrative Review Tribunal, or ART, is going to commence on the 14th of October 2024. It's going to be replacing the Administrative Appeals Tribunal, or the AAT. All appeals lodged with the AAT are just going to be transferred across. It'll be seamless and there'll be no gap, but it will no longer be the AAT. It's going to be changing to a new tribunal called ART, the Administrative Review Tribunal. Okay, so you can now ask for an explanation of a decision instead of a review of a decision at this point. If you ask for an explanation of a decision, you can still then, after getting the explanation, lodge a review of the decision and lodge an appeal of the decision. Okay. So there are time limits when appealing decisions, and it's really important to remember these, because if you don't appeal within a time limit, then your appeal may not be accepted at all, depending on what level you're at. Or if it is accepted and you win your appeal, you won't be back paid. You won't get back paid to the date that decision was made. You won't get back paid to the date you lodged your application. You'll only get back paid to the date that you lodged your appeal. And you could be losing a really massive amount of money if you don't lodge that appeal in time. So the time limit for the disability support pension appeals is if you get that original letter of rejection, that original decision, you've got 13 weeks to lodge an appeal to the authorised review officer. If you get an authorised review officer's decision, you've got 13 weeks to lodge an appeal to the Administrative Appeals Tribunal. And if you get an Administrative Appeals Tribunal decision, you've got 28 days to lodge an appeal to the General Division of the AAT. It's 28 days as well to lodge to the Federal Court, but we don't recommend appealing to the Federal Court without getting legal advice, because it will cost to lodge an appeal. And if you lose your appeal, you may be required to pay the legal costs of Centrelink. Okay. Whereas appeals at all other levels are free. Okay, so top tips for appealing the disability support pension decisions. Sometimes we will still, even if we think that there's absolutely no merit, we sometimes we still advise you to appeal a disability support pension rejection, especially depending on when that decision was made and what the letter looks like, because authorised review officer decisions contain more information than the original decisions. However, new original decision letters were released on the 3rd of March this year, and they contain significantly more information than the old ones do. They will often contain information about what impairment points, what impairment tables were used, whether there's been a program of support has been an issue, and where that issue comes in. So look, some of the new letters are much more helpful, and we're actually not advising people to appeal to an authorised review officer as often now, unless there really is merit. But previously we're advising people to appeal to an authorised review officer just to get some more information. Okay, so last little bit, 60% of all applications for the DSP are rejected at initial application, but you can win and be granted on appeal. You can apply new evidence to support an application and an appeal at any time, but they're looking at whether you're eligible on the day you lodged your application or whether you became eligible within the following 13 weeks. So make sure any new evidence you provide is talking about what your condition, what your client's condition was like on the day you applied. Okay. You can also lodge a brand new claim at the time as appealing an older one. Has there been a significant change? Has there been a new diagnosis? Has there been different treatment done? Is a different condition now a factor? Then maybe you appeal to the Administrative Appeals Tribunal for an old application and you lodge a new application with the things that's been changed. Okay. Legal aid represent at the General Division. They also can do grants for medical reports, so it might be worth exploring there. And look, as I hope I've made clear throughout, look at what's, easiest, cheapest, quickest. If they're getting knocked out at one of those earlier stages, don't go to specialists. If they, don't follow through, don't spend the money, the time on anything that's not going to actually get them through that process and get them through those box tickings. All right, so we're running low on time, but any more questions?
Okay, so yeah, we are running out of time because we do have some more slides to get through, so we'll have to make it quick, unfortunately.
Yeah, we've got a few minutes. Yeah.
Our reports from Allied Health, for example, occupational therapists and speech therapists considered for the points table.
Gotcha. Oh my God, yeah. Yeah, and those NDIS reports on on capacity and functioning for NDIS applications can be incredibly helpful. Just be aware that they're often trying to show how someone might improve, so just be conscious of that, because that can be detrimental for a DSP. But yeah, they're incredibly helpful.
Okay, sorry. So somebody was talking about how most clients don't start the DSP process until they run out of medical exemptions. And the ability to run out seems to come as a surprise. Is there any process in Centrelink requiring them to warn clients that the medical exemption has a limit?
No.
Okay. Sorry. I think if we just want to get through the rest of the slides, and then if
we'll
there's
come
a little bit of time. Is that,
yeah, sure.
Yeah. Okay.
All right. So look, just to really quickly, we are running a community of practice for people practicing in the disability support pension space, where they're helping people to access the DSP. We have membership limited at 20 to 25 people for New South Wales residents only. My understanding is that there still may be a couple of positions or spaces available. If you're interested in applying, please use the URL at the bottom or the QR code. It's monthly 90-minute training that is specialist training on a particular area of the DSP that members have said that they're interested in, as well as case discussion. So members bring their cases, bring their clients and the issues that they're facing, and the members are sharing their knowledge and sharing their tips and their skills. So we ran our first community of practice for 12 months last year. It just ended in July, and we're about to start our new one. So, we'll be, you need to put in your application before the close of business on the 8th of August, and we will be confirming membership on Monday the 12th.
Okay, that's me. Okay, so our online community worker training schedule is available on our website, and registrations are now open for our upcoming Students and Centrelink Payments webinar, which is in September.
And look, if you have a look down there, you can see the Migrants and Centrelink one is there for anyone that's interested in that side of things as well.
If you have a problem with Centrelink in New South Wales and you wish to speak to someone at Welfare Rights Centre, our client intake line is open every Monday and Wednesday from 9:30 a.m. to 12:30 p.m. and the number is on the screen. Or you can contact us online through our website or via email. Inquiries can be made through our website, and we also have event registrations there, and it contains fact sheets and other useful resources. So please follow us on Facebook, Instagram, and LinkedIn for regular updates and educational information regarding Centrelink. We would appreciate it if everybody could take 5 minutes to please complete our evaluation survey. Your feedback helps us to improve, and it also helps us to secure funding so that we can continue providing free webinars like the one you attended today. So there's the QR code, and I will also be sending out an email shortly after this finishes that has the link.
And we have 4 minutes left until 4 o'clock. And so I will be spending the next 4 minutes answering questions.
Okay, there is a question here. It is a little specific, so if that's an issue, just let me know. But I thought it was interesting. This person has a client who has chronic pain. She claims that she can't work or study. Her GP rejected filling in the forms. I'm assuming that this was a bulk billed GP, and they said that they weren't getting paid, so they refused to fill in the forms. And this client doesn't have any evidence because they were in a DV situation. So this person would like to know what they can do to help this client.
Yeah, no worries. Look, unfortunately, it's not uncommon for me to say, I'm ever so sorry, you're going to have to find a new GP. It's not uncommon for me to say that. You know, if you're not getting what you need from the GP and the GP is the only source that you can find to get something, then you're going to have to find a new GP. And I recognise that when you're looking in rural and remote areas, that's, you know, that can be an impossibility. It might be that there is only one GP in a town. But if the reason that they don't have evidence is because of domestic violence and the paperwork has been lost, so maybe they've had to flee their home and leave everything behind, then maybe start looking at whether you can recreate some of that paperwork. Can you go back to the hospitals and do a request for hospital records? Can you try and get records from old GPs? Look, if you can't get the paperwork, then maybe you can do a Medicare records application where you might even just be able to get a list from Medicare of appointments that have been attended. So I had a client who we couldn't get any evidence out of their psychiatrist that they'd been seeing for 30 years. They completely refused to acknowledge that we existed and refused to give us anything. So we did an application for Medicare claims, and we found we got it's a spreadsheet from Medicare that basically listed every time that a claim had been made to Medicare for health something. We found that practitioner's number. We found where the claims were made in order for those appointments with the psychiatrist, and we provided that to the tribunal as evidence that they'd received treatment from a psychiatrist. So there's all different sorts of places that you might be able to go to get evidence if you don't have a helpful GP.
Okay.
It's probably last question, I imagine.
Yeah. If you put in a new application for a DSP while appealing an old one, can the Commonwealth use the old DSP application against the new one?
Look, you put in an application for the disability support pension, and Centrelink can look at every single piece of medical evidence and document that is in their system. So they will look at those SU 415 or whatever 413, you know, those medical certificates that the GP has submitted to get you exemptions from from mutual obligations. They will look at every piece of medical evidence that might have been submitted for every DSP application in the past. They can look at everything. If it's there, they can look at it.
Okay, well, we hope you all enjoyed the session today, and we hope to see you at future events. And thank you very much, Donna.
Thanks for coming, everyone.
Thank you.